Hi, you guys. Thank you for joining me tonight on Ask the Egg Whisperer. I called my sister today and I annoyed the heck out of her. And what I said to her was, hi, I'm just calling to sprinkle a little sparkle on you today. Sometimes you just got to say those things to get yourself in the right mood because some days aren't as good as other days. So if you just say those things, then maybe you're going to be in a better mood. And then I started going like a little bit, over the deep end, maybe with this thought of like saying things to make you laugh on the inside, but maybe on the outside and maybe both. So I started replacing the word shot. Okay, guys, if you're under the age of 18 or offended by profanity, of course you can hear swear words if you're under the age of 18, hold your ears, I would say, if you're just offended by profanity. So I played this game in my head and then I was like, oh my God, this is such a fun game. I need to share it with everybody. And that is this: replace the word shot with shit. Did you take your shit? Is this shit supposed to be that big? How large was your shit? Did you put your shit in your butt? Anyways, you guys, it's so funny. It doesn't get old. And then I did this other thing today. I know so many things just in one day. And I think this is what happens when you go to sleep at 1 a.m. and you wake up at 5 for your first egg retrieval at 6. And you're just so ridiculously excited to help everyone you meet. And then all of a sudden you're like, that word ridiculous, come on, we just got to add that to the list of things to say. So I played this game with my patient and she was on Valium. So she was laughing because, when you're on Valium, you laugh at everything that I say. No, she was a great team player. And I said, I'm just going to say ridiculous in every single sentence that I say to you right now. Like, this is a ridiculously awesome looking lining. Like, oh my God, this is a ridiculous looking embryo, right? You just say that. You're like, God, I just feel ridiculous. And I'm just going to smile. Okay. So try that. If you have a family member that maybe is a little bit down, just call them and be like, hi, I'm calling to sprinkle a little sparkle on you today. And then I promise you I will not try and spell the word sparkle and tell you what it means, because now it's on my Instagram page and you can see it on my profile and you can go to the sparkle checklist and make sure you know all the things that you need to know every time you have a follicle check in your IVF cycle. So that's the sparkle checklist for those of you guys who don't know. And for those who are joining me who are like, wait, what is this Ask the Egg Whisperer lady? What is she talking about? Replacing the word shot with shit? Like, what is wrong with her? I promise you, nothing is wrong with me. I'm just ridiculously excited to be here right now and to answer your questions. So let's get started before too long. This first question is from Andrea. Thank you for all you do. I love your show. I just finished my first ever IVF cycle and I had 18 follicles, 11 retrieved. Based on follicle sizes, my doctor estimated that these would all be mature. However, only 4 were mature and fertilized with ICSI. I have lean PCOS, but have gotten it under control with a paleo diet and supplements. Is it normal to have such few mature eggs? I was triggered with a dual Lupron trigger to prevent OHSS, and I'm worried that prevented my other eggs from maturing. What should I do differently next time? Okay, Andrea, I think you're right. I think if you had 18 follicles, 11 retrieved, and 4 mature, it is possible that just using Lupron could have been the reason why you had less mature eggs. And I get it. It's COVID. We don't want anyone to go to the OR or ER. We don't want anyone to have OHSS. We just want you to have a really nice recovery, beautiful eggs, and just to be at home and just calling us and telling us that you're feeling well. No one wants to get that call that I just had my egg retrieval and I'm feeling short of breath. So I think what you learned is, adding a little bit of HCG might have helped with the egg maturity. Looking at the time that your trigger was given, the time your egg retrieval was done, looking at the size of the follicles can help, and making sure maybe next time you wait one day and at the end of the day. I hope that next time is no time. I certainly don't want you to have to go through another cycle. And if you have to, make sure that they have healed your PCOS, looked at your testosterone level, even though you're lean, to get it down before another cycle. This next question is from Jenna. Jenna says, hi, Dr. Aimee. My husband and I have done several IUIs that were unsuccessful. We were not looking into IVF, and my doctor then mentioned a mini IVF, but what is the difference? Thank you so much. Okay, so this is the difference between mini IVF and standard IVF. When people talk about mini IVF, usually what they mean is getting a low number of eggs. So if you have a mini number of eggs, doing mini IVF totally makes sense. If you have a lot of eggs and you're doing mini IVF, ask your doctor, is your goal to get around 3 eggs from me? Yes or no? Because I've seen this before. People have a lot of eggs, they go in for their mini IVF cycle and they're like, I saw 15 follicles, but they only got 3 eggs. And I'm like, I know, you signed up for mini IVF. Like, that's what you did. So there are situations where I use a mini IVF approach to get a maxi number of eggs. So that's something that I do, and I think it can somewhat help. So thank you, Jenna, for that question. This next question is from Melissa. Melissa says, "Hi, Dr. Aimee. I recently found your podcast and I love it. A few times now, I've heard you mention increasing manipur." That's the French version of manipur. You guys all know what manipur is, but manipur, it's different. "As a possible solution to different issues. I'm wondering if you can explain when and why manipur would be increased or decreased for that matter. I really can't understand when one would benefit from different ratios of FSH and LH. I ask because my next round will be 450 manipur and 150 gonal as opposed to 150 manipur and 350 gonal for my first round. I asked my doctor who refused to answer, and that's a whole separate issue. Thanks again. I really appreciate all you do." Melissa, it's like I have experience with using manipur, and in my hands, I find that the embryos sparkle much more brilliantly and manipur more dominant cycles. Isn't that weird? Like, that's how I feel, but like someone else might be like, "No, that's not good." And I'm just like, dude, I've been here like for a while. I know I look 25, but I've been doing this for some time now. And so I've had patients who've done the opposite, just like what you did for your first cycle. And they come to me and I just do a little switcheroo and it's like, voila, we have gorgeous embryos. But at the same time, I've done my voila the first time and I'm like, oh, I didn't like that. So we're always just rethinking what we can do differently. But I don't know that there's a test that I can do on someone. And I really wish that we had some pharmacogenetic type test. Wouldn't that be cool? Where I can just look at your genes and then spit out a protocol that would be perfect for you to give you the highest number of mature eggs. And we just don't have that because it would make total sense, right? I mean, we can get a vaccine in less than a year, but I can't get something as simple as a test like that done. Maybe I need to nominate myself as fertility surgeon general. Kamala Harris, call me. I need to help. Okay, this next question is from Melissa. Melissa says, "Dr. Aimee, Melissa, I already answered your question. Moving on. Thank you. Arun, hi, wonderful Dr. Aimee. Well, that's really nice. I'm 32, have PCOS, stage 1 endometriosis. What transfer protocol do you recommend for me? I've always gotten pregnant in the past with a FET protocol of ganirelix, estrogen patches, PIO, endometrium, but I lost the pregnancies before I got a heartbeat. It's been 3 losses so far. Do you think a protocol change is required or should I get my uterus checked again? I recently had it checked. I had endometriosis and a polyp removed. I had the ERA done. I see a reproductive immunologist. I'm doing acupuncture. I'm waiting for genetic results of the process of conception. What am I missing? Please help. Love you." Aw, thank you. Okay, so this is the thing. What it sounds like is you have not done genetic testing on the embryos. That makes sense. Letting the pregnancy guide you, super smart. So that pregnancy that you are having tested, I think will really lead the way for you. If the pregnancy was genetically abnormal, that tells you to go down one path. If the pregnancy was genetically normal, that tells you to go down another path. Normal, start looking at things like autoimmune issues, look at anatomic issues, endometriosis and whether you should treat it better. If there's adenomyosis, that's what I'm talking about. If it was abnormal, then you have your answer. And perhaps you should look at doing a chromosome analysis on both of you and think about doing genetic testing on your embryos before your next transfer. This next question is from Sigri. My husband did a varicocele surgery last year, and the semen analysis revealed he's now producing 2 million sperm. What is the best method to get pregnant? And what are our chances of getting pregnant? We're both 28. Sigrid, great question. So for those of you who don't know, a varicocele is a dilated vein that sits around the testicle, right? Just like varicoceles we can have in our legs, you can have a varicocele around the testicle too. Testicles do not like to be hot. That's why guys carry their balls. I just said balls. Every time I say balls, take a shot tonight. That's going to be our word of the night. Balls. So guys carry their balls. I just can't stop saying that word. Maybe that's why I created a method called balls method in their scrotum outside the body. Women, we have ovaries inside the body and they like to be snuggly and warm. So like using a heating pad on your tummy, getting in a hot bath doesn't cook your eggs. Just like It just doesn't, unlike for guys. So my point is this. So removing a varicocele can be really helpful, and having a sperm count of 2 million still makes me think, I wonder if there is more improvement coming your way. And I also wonder if there's more we can do. So Ball's method, I just plugged that, right? So consider doing a sperm DNA fragmentation test, going back and seeing if there's a recurrent varicocele. And I'm going to keep talking because that's what I'm going to do tonight. Looking at lifestyle and making sure that he's not smoking from the bong, please, or smoking... the bong is weed. You notice that I don't do weed because I have no idea how to use the lingo. I'm sorry. Smoking cigarettes, chewing tobacco, drinking alcohol more than occasionally, and take his supplements and exercise most days of the week, and making sure his testosterone levels are normal. And if not, there are things that you can do to boost the sperm, because I want everyone to get pregnant without my help. That is ultimately my goal for every single person that I meet. And so by doing these things, maybe you can get the sperm counts up so you don't need anyone's help. But if you do, a sperm count of 2 million to me says go right to IVF and do ICSI. That's what I would recommend if you're a patient of mine. If after we did all the balls checking, everything checked out normal and there was nothing else that we could do that's in our control to improve the sperm count, I would go right to ICSI. This next question is from Mona. Hi, Dr. Aimee. Thanks for your time. We are 39 from Melbourne. My AMH is low and my hubby's DNA fragmentation index is high. He took supplements for 3 months. I took 4 cycles of IVF and no embryo still. First cycle of Gonal-F 450, Pergoveris 150, and then I did a cycle of just Manipur 600, and each time no fertilized egg on day 1. Then I changed my clinic. I took priming meds, letrozole, Puragon, Menopur, 1 fertilized egg, and it stopped growing on day 3. Last cycle, I used Lupron, Gonal-F, Menopur, trigger shot 38 hours, but just 1 out of 4 was mature and stopped on day 3 again. What is your suggestion? Should I keep going? Is there any chance for me? What protocol do you suggest? Low dose of meds. Thank you for your time. I hope you can help me figure out how to continue my journey, or if this is the end. Okay, Mona, so you've done 4 cycles already, and we know the diagnosis. The diagnosis is there is an egg issue, and it seems like we're dealing with egg maturity. That's a really, really hard one, but I'm going to share with you some of my tricks and tips. Here we go. With the trigger shot, consider taking closer to 20,000 units of the HCG hormone and maybe even adding a dual trigger. Look at the size of the follicles that you're triggering at and see if your doctor feels comfortable going to 20 to 24 millimeters. I think that in some cases, adding HGH can increase the maturity of your eggs, and maybe even starting it now ahead of your next cycle could help. Maybe do it 2 times per week. Not every doctor feels comfortable with this, so if your doctor doesn't feel comfortable with it, that's okay, and you might not even have access to this drug in Melbourne. And be sure to look at all the lifestyle stuff, look at your nutrition, look at your fitness, look at your mind fitness, you know what I mean? Think about meditation and mindfulness and incorporate that into your daily life. And consider taking all the supplements that I talk about all the time here, like NAD, pterostilbene, CoQ10, prenatal vitamin D, and fish oil. Did you get that? Okay, Mona, thanks for that question. I think it might be worthwhile to try 1 more cycle. However, go back to what I shared with you guys about Sigri's question about the sperm, because all of those things are what we want to think about for the sperm if the DNA fragmentation is high. We want to see what we can do to bring it down before your next cycle, because I want us to have closure after this next cycle and see what other options you might want to consider from here. But I do think before that, you want to go out and really feel like you've done your very best with this next cycle. And I know you've done your very best. You know what I mean. It's that you've considered everything, and that might include doing a sperm extraction if the DNA fragmentation is super high, but get his balls checked, look for a varicocele, lifestyle, labs, supplements, all that stuff. Okay, Sarah, hi. Thank you for thank you for asking a question all the way from Ontario. I am 33 years old. My husband and I have a 5.5-year-old boy with hearing loss. We found out we're both recessive carriers for hearing loss. After 2 years of trying for a second child, we were referred to a fertility clinic and found out my husband also has low motility and count. IVF with ICSI was our only option, and 23 eggs were retrieved. 12 made it to day 6. We sent 10 embryos for PGTM for for hearing loss, and PGTA for a chromosome check. We have 3 untested and frozen. 1 is affected with hearing loss gene, and we will not be transferring this one. We can transfer 4 as 1 is unaffected with hearing loss and is chromosomally normal. 3 have normal chromosomes but are carriers for hearing loss. The doctor said ERA is an option and there's no reason for us not to do it. We agreed to proceed with it before the frozen embryo transfer. Do you think it's really necessary for us? We have no recurrent losses. First time IVF frozen embryo transfer. Okay, Sarah, it sounds like you have a fabulous number of embryos, or I should say a ridiculous number of embryos. That's what it sounds like. Given that you have 1 child, I don't know how many more kids you want. If you want 4 or 5, obviously, I'm just saying that like, haha, like who would be crazy enough to want that? Because that's what I have. And I would love a 5th. Honey, are you listening? I'm just kidding. With what I do for work, you guys know what pregnancy envy is. I'm telling you, it's legit. It's real. I mean, like, I'm out of healthy eggs, but I swear, like, I get it. So anyways, I digress. So my point is this. No, you don't need to do the ERA. Like, just see what happens with your first transfer. But look at the implantation rate per embryo. What I find is sometimes people aren't told what the quality of their embryos are. What if the 1 embryo that has an over 50% chance of implanting is the one you transfer the first time, and then you do the ERA test, and then you learn that the timing was off? You might feel pretty bummed that you hadn't done the ERA test. But so I would go ahead and look at the embryo diamonds, the 8 things that you should know about your embryos, and be sure to rank them based on quality, and then look and see how many embryos that you have that are top quality that will give you the best chance of success, and then go back and see if you want to do the ERA test or not. So that's the algorithm that I go through with my patients before I decide to ERA test or not to ERA test. That is the question. So I have another question here from also Sarah. Here we go. She is saying, she's adding more to this question. She actually sent in 2 because I have a limit in terms of the number of words you can add to these questions on Ask the Egg Whisperer. So for those of you who are like, where do I send in my question? Go to asktheeggwhisperer.com and that's where you send in your question. So she's talking about her thyroid being borderline high. Her TSH was 4.45. She was referred to an endocrinologist who started her on Synthroid, and then the TSH went down to 0.58. She then started feeling really bad, like anxious, heart racing, and then her TSH went down to 0.04. The endocrinologist said, stop the Synthroid medication, and then the repeat TSH was 0.2. The endocrinologist then said she can stay off meds and start IVF, and her question is, do you have any concerns with my TSH as I now do the ERA and a frozen embryo transfer? Our doctor doesn't seem concerned. I agree. I'm not too concerned, but I would look at a complete thyroid panel, including the thyroid antibodies. If the thyroid antibody test is negative, negative, I'm less concerned that something, it's going to somehow affect your transfer. If they're positive, I would kind of pay attention to what's going on a little bit more closely than, typically I would say, just check your TSH every trimester. And certainly with your first pregnancy test. And in your case, you might want to check it every 2 weeks as you're on the hormones, as that can affect your thyroid metabolism. This next question is from Alina. Alina says, what are your opinions about the trigger shot, Ovidrel versus Lupron? I hear Ovidrel has a higher success rate in IVF, but it can cause severe OHSS, especially in patients with PCOS. That's good. Ovidrel can cause OHSS, especially in patients with PCOS. That's a good one. I need to write that down and remember it. Where's my pad of paper? Oh, I know I have a pad somewhere. Okay, I found my pad. I have to write that down. That's a good one. I have PCOS and my doctor's afraid I'll get OHSS. What is your experience with both of these shots and what are your opinions? Also, I have Hashimotos and psoriasis, which are both considered autoimmune disorders. Can they cause problems with implantation, and how? Is there another way to help besides just taking Synthroid and trying to lower inflammation? Thank you, Alina. Okay, Alina, here's the thing. You are right. Ovidrel can cause OHSS in patients with PCOS. So you have to be really careful with how you trigger and how your doctor manages these symptoms. So I feel like a broken record, but I'm not going to stop talking until every single person knows my recipe for preventing OHSS. And I know a lot of people know it, and I'm not saying your doctor knows it, but I feel like there are people out there who could benefit from hearing this. So I do use Ovidril as a trigger shot, but if someone has, let's say, an estradiol level that's really, really high, then it makes sense maybe to just use half of the Ovidril. You just inject half, or you just use Lupron instead. So that's kind of the way you could do things. And it's true, you might get less mature eggs, in my experience, if you just use Lupron. But I think the pros of not having, it's so much better not to have OHSS, trust me, than potentially to have gotten a few more eggs. And I know that's hard to believe, but if you've ever met anyone that's had severe OHSS, I think that looking back, if you were to have asked them, they probably would have said if they had OHSS from using an HCG trigger shot, I bet they would have much rather have avoided all those complications and used a Lupron trigger shot. So my other tricks are you can use cabergoline, parlodel, bromocriptine. Those are some of the names you'll hear out there for a dopamine agonist that can be placed vaginally or taken orally every night. With the trigger shot, you can also use letrozole, also known as Femera. You can even take the trigger shot, not the trigger shot, you can even take ganirelix, use whey protein, salty drinks, heating pad, stool softeners, you name it. I'm going to come up with a preventing OHSS algorithm or checklist, or maybe a song, or maybe a method. One day. It's coming to an Instagram live near you. As far as your question about Hashimotos and psoriasis, yes, you're doing all the right things by following an anti-inflammatory diet and taking your Synthroid and also monitor your thyroid levels. But unless you have symptoms of, other things like joint pain, for example, I don't think you have to worry about doing more testing. And I'm not concerned if your thyroid is well managed that you're going to have a lower chance of implantation. Okay, this next question is from Stacy, and Stacy says, please help. I've had 2 IVF retrievals resulting in both overmature and undermature eggs. First cycle estrogen priming with ganirelix, 150 manipur, 300 FSH, microdose Lupron. HGH also triggered with 10,000 pregnal on day 10. My estrogen level was 1,075, and I had 5 follicles over 16 millimeters. 2 were overmature, and 2 GVs were immature, 35-hour retrieval timed trigger. Okay, second cycle, testosterone priming. My follicles, I'm not going to go through all of this, guys, but what I'm going to tell you is that 1 overmature, 1 mature, 2 M1s, which means intermediate stage, and 2 germinal vesicles at retrieval. 2 M1s matured in the lab, but didn't survive ICSI. Gutted by the results, I advocated hard for testosterone priming because I've been chronically low, but high DHEA, assume not converting well. Thoughts on what to do different. Also pushed for dexamethasone, but told no. I have signs of inflammation. I seem to respond to stim, but not getting maturity. Okay, guys, Stacy, you kind of gave me the answer in your question as to what we would do differently. So the first thing I would say is 35 hours of trigger might not be ideal for your body. I would say trying a 36, maybe 36 and a half hour trigger might make more sense. I don't know so much about overmature. I'm not sure necessarily what that means. So why did your doctor think that your eggs were overmature? So if an egg was dark or grainy, that might be an egg quality issue, but I'm not necessarily thinking of overmature based on the sizes of the follicles that you shared. So having, especially in your second cycle, 1 mature egg, 1 overmature egg, just tells me you got 2 mature eggs. With an estradiol level of 1,088, I would say I would expect at least 5 mature eggs, but this is the thing. You had a 16, 17, 17, and 19 millimeter follicle, okay? Only 1 egg or 1 follicle was over 18 millimeters. So I'm thinking, if anything, you should wait maybe 2 days until your trigger shot. That's kind of what I would do if it were me. Wait 2 more days, get your eggs super juicy, like super, super juicy, and then trigger at 36 hours. That's kind of what I would think. And as far as dexamethasone and testosterone priming, I don't necessarily feel too strongly about that. And the DHEA, if your DHEA is high, maybe it's because you're taking DHEA, and if it's not converting to testosterone, that's actually, I would consider that a good thing. Okay, this next question is from Lois. Lois says, hi, Dr. Aimee, I'm totally hooked to your show. I'm starting my third IVF cycle after a 12-month break. I have endometriosis and mild adenomyosis. I'm 37 years old with an AMH of 0.2. I've been on DHEA for 2 months leading up to this cycle and have seen huge improvement in my AMH. My only concern is it seems to have caused a flare-up in the endometriosis as I have a 3.8 millimeter cyst, I think you meant centimeter cyst, on my left ovary. My right ovary is endometriosis free. My doctor wants us to retrieve as many eggs as we possibly can before we treat the endo and adeno. We will be doing an FET. My question is this: how would you treat the endo and adeno after retrieval if I was your patient? How would you treat me after the retrieval leading up to the FET to boost my chances of having a live birth? P.S. My first cycle was successful. We got 2 embryos, transferred both, miscarried at 5 weeks. Thank you for your advice and really love your jokes. Thank you, Lois. I'm glad somebody likes my jokes. Because when I called my sister to tell her I was calling her to sprinkle some sparkle on her, she hung up on me. True story. She says that I need to cut out the sparkle nonsense, but I'm not. I'm just not. Sorry. So in a case like yours, Lois, what I would do is this. Do the work just like you're doing to bank as many embryos as possible. I would consider genetic testing of your embryos because what I can't tell is if the pregnancy stopped growing because they were genetically abnormal or if it was from the adenomyosis, right? This is the thing. With your AMH of 0.2, I just don't know when you're going to stop making normal embryos. Everybody, it happens to us 100% of the time at some point. For a lot of people, it's when they're over the age of 37. I know it's hard to hear because most of my patients are over the age of 37, but we want to talk about the real deal, pragmatic and practical expectations as far as what treatment can do for us so that you guys feel fully informed and have all the facts before you start doing this thing called IVF. So my concern is that just like your concern, the endometriosis could be causing a problem. And if you have adenomyosis, what we want to do is have them clarify, is it mild, is it moderate, is it severe? I want you to have a baby with your own DNA. Truly, I would want you to carry a pregnancy as well. But if it seems like your only chance of having a baby with your own DNA is if you consider other options, that's something you would want to know now while you still had those embryos frozen. So talk to your doctor about maybe considering a laparoscopy, Depolupron, protocols that involve doing a mock cycle first, like the ERA test and the Receptiva DX test. Follow an anti-inflammatory diet, and then ask your doctor. I know, people can ask me this, and I totally tell them this, but not every doctor has this sparkle, guys. Not everyone is this annoyingly optimistic and annoyingly just annoying, because I know I'm not for everybody. The lipstick I wear that no one can see because I wear a mask on is lost on everybody out there. I'm just kidding. I do not wear lipstick except when I'm here. Actually, I don't wear a dress. I just wear scrubs all day long and my sneakers. So anyways, back to your question, Lois. So that's my answer. So I hope this really helps you. And there's a supplement called N-acetylcysteine that might help prevent the progression and growth of endometriosis. I don't know why it helps some people and why it doesn't help others. But I would just get on the schedule of an endometriosis expert, a minimally invasive gynecologic surgeon, and see what they have to say about your case as well. Next question is from Ashley. Hi, Dr. Aimee. I'm 29 years old. My husband is 31. 2 years ago, we got pregnant on our second try of Femera and timed intercourse. This time, we've been doing gonal and timed intercourse for 5 months, and we finally just did our first IUI. I was shocked that my husband had very little sperm. Crazy. Only about 300,000 sperm cells. He has a large varicocele, but our doctor doesn't think correcting it will help that much. Is it possible if he corrected it, he could have 50 million? Do you think it's possible he had a lot more 2 years ago, but because of the varicocele, it got worse? Or could have gotten pregnant from this sperm 2 years ago in just 2 tries? We're planning on going straight to IVF, but I'm still curious to know what you think of embolization procedure. If he does do it, what are the chances it could reverse? We are both taking CoQ10 DHEA. Thanks so much. Okay, Ashley, here's the deal. You're 29 years old. It looks like you got pregnant 2 years ago. You had a baby. That's awesome. I'm thinking, what's the rush? Like IVF? How about give yourself another chance at getting pregnant with not doing IVF? I would say if you were a relative or a family friend, a neighbor, anyone at the drugstore, the grocery store, or in an elevator with me, or on Instagram, I would tell you, remember, diagnosis before treatment. Do everything that you can to improve your chances of pregnancy at home before you do an IVF cycle. There's no rush. The last thing you want to do is do IVF and get very poor embryo quality, or have beautiful embryos and have them not implant and wonder if it was sperm DNA fragmentation affecting things. So if you want, you can do a sperm DNA fragmentation test and use that as a traffic light, or I should say an IVF light, to say red light or green light before you move forward. But, unless you're in a huge rush to go right into IVF, I would suggest talking through these options that I'm bringing up with you and maybe think through doing a varicocelectomy and see if that would help. So just a suggestion. This next question is from Nina. Hi, Dr. Aimee. Thank you for all you do. I'm a 34-year-old with an AMH of 5. I got it drawn again like 2 months later, and it was 2.3. Like, what the heck? Maybe the first lab was wrong. Anyway, my partner and I have been trying naturally for 5 months. We're both in good health, no known fertility issues in my family, and we'll soon get additional checkups done like the semen analysis, HSG, etc. My question is, do you ever have patients skip IUI and jump straight to IVF for reasons like a higher likelihood of success per cycle, potential for getting additional embryos to freeze for embryo number 2, and being able to do genetic testing and getting to choose gender of the baby? Nina, you've clearly been watching my show, so yes. I always say that we should be having embryo freezing parties, right? I started egg freezing party in 2014 to educate people about saving their eggs and how important it is to have that, or to have that awareness that is actually an option if you choose to do it for you, which is a very personal decision. But I also feel like embryo freezing parties should be a thing too, for people to know the benefits of freezing embryos. Unless you want to save eggs for husband number 2. Shh, Nina, don't tell your husband or partner that I said that. I'm joking. I really am. But I do think that all the things that you outlined are exactly the things that I share with my patients. If you're over 32 years old and you want at least 2 kids, seriously consider freezing embryos. That's one of my egg whisperer golden rules. I think it's number 4, actually. Great question. Next question is, Dr. Aimee, thank you for everything. Apologies in advance if this is a dumb question. My last few pap smears were abnormal due to positive HPV. As a follow-up, I had a colonoscopy in April 2020, and the doctor did not see anything that was of concern, did not send anything in for biopsy. However, I'm wondering if the positive HPV can cause fertility issues, and in particular, since I know some STDs can cause fallopian tube blockage, I wonder if I should be concerned about this and try to get an HSG. Nina, my answer to that question is yes. So if you were exposed to something that, gave you HPV, which we know is a sexually transmitted infection, certainly there could be something that could have also caused tubal blockage. Is there a chance your tubes are blocked? Yeah. Is it high? Probably not, but I still think it's worthwhile checking, because I can tell you, finding out after 1 year of trying that you should have not been wasting your time doing that because your tubes are blocked would be pretty disappointing and kind of annoying, to put it mildly. So if you're open to doing the tube test, I strongly consider you doing it. And I would say when I see my egg freezing patients, I actually talk to them about that. I say, look, like if you had an abnormal pap smear or you had some sort of STD, your tubes could be blocked. So you actually may seriously need these eggs for future pregnancies, especially if you want to have more than one baby. So sometimes I actually even do a tube check on my egg freezing patients, so they make sure to freeze enough eggs, especially depending on their age when they're starting. That would be kind of one of those bummer things where you find out later that you should have frozen more eggs, because you really needed your eggs to have your babies. Okay, guys, I'm going to take a break right now, and I'm going to read you something pretty profound that someone said to me today. This is pretty profound. I actually wrote it down when they said it to me. They said, the process of having a baby is just as important as getting the baby. Mic drop. And that's why I do what I do. And I was like, wow. She basically read my mind. I'm like, you're in my head. I want the process of being a fertility patient and the experience to really be important as the end goal. Because if it's not, then you're traumatized, you're depressed, you're more anxious, and certainly no matter what I do, those things still come into our hearts, our minds, our heads. But I just said, wow. And then she said this, what you're doing is supposed to be fun, right? And life-giving. And I was like, that sounds really good. You know, that like if I tell a patient, like, this is supposed to be fun and life-giving, and this process is just as important as getting the baby, it kind of changes your perspective of living in the moment and, you know, tuning into what you're feeling and just taking in everything and all the experiences that you're having. And then try and replace that word shot with shit and just be like, am I ready for my shit now? For those of you who are just joining me now and you're like, I think that she does not have coffee in her mug, you got to watch the beginning of Ask the Egg Whisperer tonight to know exactly what I'm talking about. Okay, this next question is from Yvonne. Yvonne says, hello, Dr. Aimee. I love watching your show. You're so amazing. You've given me hope and strength to go the IVF road alone. Yvonne, you're a lot braver than me. I'm proud of you. I'm single, 40, terrified to find out what my eggs look like since I'm old. You're not old, Yvonne. If you're calling yourself old, what am I, right? I mean, I think I'm like 25 years old and I'm over 40. I would like to be pregnant by March of 2021, so I'm going to an IVF clinic in Arizona in January. I'm hoping that between January and March, I can have at least 2 cycles to choose eggs from. Is this unreasonable to think this way? Yvonne, it's not unreasonable. Egg freezing and embryo freezing is for women in their 20s, 30s, and 40s. Okay, one day I'll be like, and beyond. But right now, since we can't put Botox in our ovaries, it's just for women in their 20s, 30s, and 40s. You won't know what you're going to get until, I was going to be like a box of chocolates. You don't know what you're going to get until you get your levels checked to truly know what the number of eggs are that you could have retrieved in an IVF cycle. So get that AMH level checked and then go into it with the right set of expectations and say, it might take more than 1, 2, 3 cycles to get enough embryos for the family size that I want. But I'm just going to go through the experience and enjoy the process and think of it as a fun and life-giving process, right? See what that patient just taught me to kind of share with you guys tonight, which I found to be very, very profound. It seems really simple, but with what's going on today, sometimes the simple stuff just like changes our mindset and we're like, voila. I can stop squeezing my buns to distract myself. That's a trick, you guys, if you don't know what I'm talking about. I've talked about it on other shows, but that is true. So I don't think it's unreasonable. Take your supplements, ask all the right questions, go through the Sparkle checklist with each of your monitoring visits, and sign up for my Egg Whisperer class, the IVF class. My next one is on Monday. It's always the next one is on Monday because they're always on Mondays. Maybe I'll take a break here and there. Okay, this next question is from Jenny. Hi, Dr. Aimee. I'm 35. Our diagnosis is mild male factor, low motility. My first IVF cycle went smoothly. 10 eggs, 7 mature, 6 fertilized with ICSI, 4 blastocysts on day 6, 3 normal. Our goal is to have 2 kids, so we did another retrieval, adding Clomid before stim shots. 12 eggs, 11 mature, 9 fertilized, 5 blasts, none normal, 2 mosaics, heartbreaking. We did 1 FET that didn't work, did another retrieval using the same protocol as our first cycle. Similar results, 4 blastocysts. This time, none were normal, not even mosaic. What is going on? What changed? We have done these basically back to back, so not a lot of time has passed since the first retrieval. My doctor is also scratching his head saying possibly poor egg quality. Our second FET is soon. I'm scared that if it doesn't take and we do another retrieval, we'll have a similar poor outcome. Any suggestions? Okay, so it sounds like you're asking all the right questions and doing all the right things. Get your embryo diamonds all together, okay? Especially the O and the S, the official reports, and then the sperm on the day of the egg retrievals. I wonder if they're different. Look at the sperm DNA fragmentation, see what's going on. Compare those things, because you're the same, right? And your husband's the same, but we know that for the most part, someone who's 35 who has, 3 normal in the first IVF cycle should probably still be getting normals in their next IVF cycles. So I'm also stumped as to why. So I'm just wondering if it's related to sperm. Not so fast on talking about eggs. However, it could be that first cycle was just like amazing and that was just like one cycle that you'll never have again. Is that possible? It's possible. And I just said possible like 10 times. So I think you know what I mean. It's hard to know what changed, but I would definitely look at the sperm. And that could also be the reason why the FET didn't work. So take a look at sperm DNA fragmentation, ask those questions, go to Ball's method, and figure out what you can do to make the sperm even better before you do another egg retrieval. And look at, take the genetic report, make sure you have it, make sure you read it, and talk to the genetic counselor affiliated with the genetic testing company that you worked with to see if there's anything else you guys should be doing differently as far as other further testing. Okay, this next question is from Jenny, another Jenny, but an IE Jenny, not a Jenny with a Y. Hi, I had an endometrial biopsy that was positive for chronic endometritis. A round of doxycycline for 2 weeks did not work. What antibiotics would you recommend next? You know, Jenny, I don't know. I find that sometimes people are diagnosed with chronic endometritis, and I'm not saying this because this has happened to you or this is happening to you, but I would really look closely at the report again. So if I don't see it, I don't believe it. So I have to believe it. I have to see it to believe it. That's what I'm trying to say. And really look and say, is this really chronic endometriosis? Are we over-treating something? Because I have a hard time imagining that 2 weeks of doxycycline didn't work. You can certainly try another 2 weeks, and there are other antibiotics that you can take as well. But I would also take a careful look at the pathology report, maybe have your doctor, talk to you video to video, tete-a-tete, to make sure that you're not over-calling something unnecessarily. Okay, this next question is from Glynis. Glynis is saying, hi, Dr. Aimee, I've learned so much from your show. Thank you. I'm 34, been trying to conceive for 3 years. My husband has severe male factor. He has had a karyotype Y chromosome microdeletion. Everything is fine. We did 2 egg retrievals. Both times I got 14 eggs, 8 fertilized, but we only get 2 embryos on day 6 or day 7. Never day 5. I had 1 biochemical and 2 negative pregnancy tests. My plan for next egg retrieval is to go on the list of supplements you recommend for egg quality. My doctor suggested CoQ10, resveratrol, and NAD. And I'm going to ask my doctor about PRP for my ovaries and to do ERA testing and possibly do PGS testing, but my husband and I are afraid of doing that in case possibly okay embryos are discarded. Do you have any other advice of what we can try and what we can discuss with our doctor? So I would say yes. It sounds like you've done a really good genetic workup, like your husband had the chromosome analysis and Y chromosome microdeletion. I would make sure that you've also had the karyotype as well. The other thing I would do is look at his testosterone level, varicocele check, supplement list, his lifestyle. You're on the NAD. Have him take the same stuff too. That stuff is really good for guys as well. Think about adding gonadotropins for him too. Sometimes taking Gonal-F can help a guy. Sometimes taking HCG shots, even Clomid or Arimidex, medications like that. Those have been shown to help increase sperm counts as well. So if we're increasing the sperm counts, we're possibly increasing quality, and that might help you guys. So those are the kinds of things that I would suggest, and there are always different fancy ways of getting sperm. And when I mean fancy, I mean the same way that we get eggs out from us, we can get eggs out, sperm out from guys. So it's something to consider. Last question that was emailed to me, and this is from Markina. Hello, I'm in a lesbian relationship and we've been using donor sperm for the past 8 cycles. I have doubts and fears that I might have endometriosis. My doctor referred me to a gynecologist months ago and I still haven't heard back. I'm 30, also 200 pounds is my weight and egg the issue. I'm trying my hardest to lose weight. Do you have any advice about things we can do differently at home or supplements I can take? I take a prenatal red raspberry leaf tea pills, EPO, and was thinking about Vitex. Any other advice you have for me would be greatly appreciated. Markina, this is a great question. So here is what I would think through. Everyone should do the Tushy method before they try and get pregnant. It doesn't matter if you're doing home inseminations in a same-sex female relationship or if you're trying at home naturally in a heterosexual relationship. I think, especially when you're spending so much money on that sperm, you want to make sure you're not wasting your time. Doing an ultrasound, looking at your uterus, looking over your ovaries for cysts makes sense. If you have fears of endometriosis, listen to your ovaries and get that ultrasound done, and even consider a hysterosalpingogram. With the number of IUIs that you've done 8 so far, my thinking is that there might be some sort of fertilization issue, meaning the egg and sperm aren't fertilizing inside your fallopian tube. They're just not fertilizing because they might not be meeting up. So get that checked. A simple ultrasound of your uterus, HSG, yeah, you know me. I promise I will not sing that full song for you, although I'm tempted. Maybe tomorrow. Just kidding. I'm going to spare you guys tomorrow. I won't be here tomorrow. I'll be doing lots of procedures tomorrow, but I won't be here tonight or tomorrow night sitting at this desk. The other thing is, if you feel your weight is an issue, 30 years old, 200 pounds, my only concern is that you might have high sugar levels, some blood pressure issues. But if you check your sugar levels, check your blood pressure, check your testosterone, check everything, and then see what things you can do to live a healthier lifestyle. That's kind of what I recommend. I'm not too focused on the weight part. I'm focused on seeing what you can do to make things healthier for yourself so that this pregnancy will hopefully happen soon will be healthy as well. So there's one supplement in addition to the things that you've been taking, and that is CoQ10, and the other thing is Ovasitol. You can go to the Theralogics.com website, use the PRC code TUSHY, all caps, and get Ovasitol. You can even get their CoQ10 as well. So those are the kinds of things that I would think about doing. And I hope, Markina, that your next insemination is wildly successful. But I'm thinking after doing 8 at home, it might be time to come into my office or go to a local fertility clinic's office and make sure that everything is perfect before you go through another cycle. Well, thank you guys for joining me tonight. I'm going to see if you guys have any chatted questions, and I can just fly through them real quick before I also fly to my computer to answer more questions, call patients, and then go home. So Soph is saying, what does baseline ultrasound and sonohystogram post-hysteroscopy to remove placenta show that determines if my lining will have issues getting thick enough? And the answer is, I don't necessarily rely on those things. I rely on a mid-cycle ultrasound, for example, when you expect your lining to be as thick as possible to guide me if everything is going to be okay. Next question is, hi, Dr. Aimee, do varicoceles and sperm agglutination affect embryo quality? The answer is I think varicoceles can if the DNA fragmentation is bad. Sperm agglutination, no, I don't think that that's a thing as far as affecting embryo quality. Is there hope for women over 42? There is a lot of hope, and this is a thing. You have to accept the fact that you might be having or growing your family at a time where you don't have any good eggs left. It's the reality. You got to say it out loud. You got to say it out loud. You got to surrender it. There's no shame. There's no blame. There's no game. I just felt like adding game in there because it rhymed. But truly, it is true. It is a fact that you can run out of normal eggs and not run out of your desire to have babies. And so that's why we have creative family building options. We have egg donation. I have a program called Freeze and Share. There's embryo donation. So many amazing ways of having babies. So all hope is not lost, but you may not have viable eggs left because you know what? You're normal. So most people cannot get pregnant over the age of even the age of 37 with their own eggs. And most people, once you hit 43, the likelihood is very low. The chance of a 43-year-old being able to have a healthy embryo is about 4%. So that's pretty low. Once you get that embryo, the chance of it being normal is about 10%. So you see what I mean? It's like, you know, I just say when someone has a healthy embryo, I'm like, you're just very lucky. You know, it's not like I could have willed it or I could have done something different. You know, it's like I can just work with the DNA that people have, but it's important to know that you're just human. You're not broken. Next question is from Blue Beta. What does TSH need to be before an FET? Does TSH need to be stable before transferring? Mine is 0.15, no medication. So I would say just looking at all your thyroid parameters would be really important. So doing a complete thyroid profile. Since your TSH is less than 0.4, if your free T4 or total T3, for example, are high, I definitely want you to be seen by a medical endocrinologist, especially if I'm concerned about Graves' disease. Let's see here. Next question is, Dr. Aimee, I read that if you ovulate from some follicles before the egg retrieval, even if they can save some eggs, they'd be incompetent. Is this true? And the answer is no. Do you continue with the retrieval if you see they ovulate? Yes, it depends on the situation. Next question is, I have heard that DHEA can increase risk of breast cancer. What's your idea? Do you recommend taking DHEA? And no, I have not heard that DHEA causes breast cancer. My opinion on DHEA is not for everybody. It can cause side effects, but it can help some people. I typically recommend it for women who have a normal BMI or don't have PCOS parameters, who have, let's say, less than 7 or so eggs. But sometimes I recommend it to others as well. Next question is, would you recommend getting the COVID vaccine before going for the FET? And the answer is yes, if you can wait. It would be nice to get the COVID vaccine pre-pregnancy. That means for most of us, trying to do your FETs in this early summertime, maybe springtime. Next question is, what causes premature ovulation before the retrieval? And so what can cause that is an egg quality issue. What can cause that is not being suppressed enough. What can cause that is not timing the egg retrieval correctly. What can cause that is not taking an antagonist at the right time, so you're not protected from ovulating. My doctor is recommending an unmedicated FET. I'm worried that it will be canceled as it's based on your body's natural cycle. I also hate blood work. I'm 34 and I have a period. Okay. Next question is, I'm 47. Is it possible to have a baby from my egg? And the answer is, or is it possible? And my answer is, There is a 0.09% chance that a 47-year-old can have a pregnancy with her own egg. Okay? 0.09. Okay? So it's not impossible. It's possible, but I wouldn't count on it. Unless you froze eggs or froze embryos from when you were younger. Let's see here. Well, thank you guys for answering your questions. Someone's saying, hi, Dr. Aimee. It's Zara from London. I'm waiting to start IVF because I have a ruptured corpus luteum cyst, which means she ovulated. How long does it take to resolve? Usually about 10 days until your next period. Anything I can do to help resolve it? Just time. Oh, cute. Someone just said, chickadee check yourself before you wreck yourself. Oh my God, I need to remember that. That's really cute. And someone just asked, Synthroid generic okay to take? The answer is yes. Does PCOS mean you're more fertile later in life than younger in life? Yes, for some people it means having a later menopause. And you got to chickadee check yourself before you wreck yourself. Okay, guys, well, thank you for joining me tonight. Call everyone you know and say, I'm just calling you to sprinkle a little sparkle on you. And then try and use the word ridiculous in every sentence that you use and see how long you can do that before you start driving yourself crazy. It'll probably be about 5 minutes, but it's actually a little bit fun. Or you can call someone, just do it and not tell them that you're doing it. And then you can use the word shit instead of the word shot with if you have a loved one at home, and just be like, honey, will you give me a shit? Will you give me the shit? Okay, guys, I need to go home, clearly. Okay, I love you all. I hope you're going to be here next time. I think I'm going to be here next week. Not sure which day yet. So be sure to go to asktheeggwhisperer.com, enter your question, and I'll be here to answer it. I'll see you guys soon. Bye, guys. Love you.